Hello, and thank you for attending today's educational session. It is my pleasure to introduce Lisa Moroni. Lisa is a skilled registered acupuncturist with a special focus on reproductive health and fertility support. Lisa has worked extensively with couples and individuals navigating fertility challenges, integrating the principles of traditional Chinese medicine with evidence-based care to promote balance, wellness, and optimal reproductive function. And today she will be presenting on the topic of enhancing fertility with acupuncture. And after the presentation, we'll have the opportunity for questions. So feel free to leave a message in the chat or unmute your mic. And I will let Lisa take it from here.
Awesome. Thank you, Michelle. All right. So sincerely, there is a reason that I have studied an ancient art. When it comes to computers, I repel them. So let's see here. So shares. Thank you. Sorry. Thank you, Michelle, and hello, Lisa. I am Lisa as well. I am a registered acupuncturist and holistic nutritionist with a special focus, as Michelle was saying, in fertility and female health. Um, uh, as an acupuncturist here in Toronto, I am a member of the College of Traditional Chinese Medicine and Acupuncturists of Ontario. That's a mouthful, I know. Basically, it just means that my training is a little bit different than maybe some of the acupuncture that some people haven't encountered. So very much different than the acupuncture you would receive from a chiropractor, physiotherapist, or massage therapist. My acupuncture is deeply rooted in traditional Chinese medicine, which is in itself its own medicine, and it treats the body as a whole. So, this is why, apologies, 1 second, I will get there. There we go. Okay, so my gateway into this industry was actually nutrition. So I've studied both at the Canadian School of Natural Nutrition and the Institute of Holistic Nutrition, where I developed a deep love for prenatal care. I honestly believe this is a truly unique time in someone's life that and it's also one of the main reasons that I was drawn to my work in fertility. In my experience, there are very few times when a person, especially a woman, is encouraged to prioritize her own health and well-being, which is the case in prenatal and pregnancy care. Most of the time, I swear, we're flat out busy, taking care of careers and families, and or that we tend to, well, our own health tends to be at the bottom of our to-do list. I love my job, and I feel honored to work with anybody who wants to focus and invest in themselves during this transitional time. Making this work accessible has always been important to me. It's why I work proudly with a group called the People's Organization for Community Acupuncture, or POCA. It's a group that works to make sure that treatment is available to a lot of people through community-style acupuncture. But over the years, I've had the privilege of working at a variety of clinics within the GTA, including running my own business here in Roncesvalles in Toronto. But the past 3 years, I have been part of a Gold Star roster of naturopathic doctors at Conceive Health and Trio Fertility, where we basically just specialize in fertility acupuncture and prenatal nutrition. Okay, so now that we know a little bit about me, I want to talk a little bit about what we're going to cover. So, if you don't mind, I'm just going to turn 1 second. Very expressive speaker. I'm just covering my face for 1 second. And here we go. So, what is acupuncture? Number one, what does it do? How can it benefit fertility? What to expect in your first session? And the frequency of treatment really to get the optimal results. And at the end, we'll talk about choosing your fertility prep team. And then, of course, I'm all yours. So, acupuncture is essentially the use of thin needles that are flexible and gently, it stimulates the central nervous system, boosting blood flow and supporting the body's natural healing process. Again, TCM, or traditional Chinese medicine, the idea is that fertility is seen as a reflection of inner balance between yin and yang, or the smooth flow of qi and blood. It's rooted directly in a Taoist philosophy where TCM teaches that when the body, mind, and spirit are in line, conception can be a natural expression of health. I tend to say in clinic that working on optimal health and optimal fertility, they're pretty much the same thing. I find that when people are going through fertility treatments or preparation, it's pretty much kind of the best health of your life. Like you're taking great supplements, you're taking care, you're getting good sleep. Optimal health and fertility really do overlap. By restoring balance, acupuncture helps regulate menstrual cycles, enhance blood flow to the reproductive organs, it calms nervous systems, and it supports the body's innate ability to conceive. So, acupuncture is just one of the tools that we use in TCM. So, again, traditional Chinese medicine is a complete medicine. Acupuncture may be part of a prescription of a total treatment plan that your TCM practitioner has prescribed to you. Other modalities include, but are not limited to, cupping therapy, gua sha, tuina or shiatsu massage, qigong, tai chi, nutritional therapy, herbal medicine, and moxibustion. One of the core ideas behind TCM is that the body is not a collection of separate parts. It's a connected dynamic system that is always working to maintain balance. I swore I wasn't going to go too far down the rabbit hole, but I think it is necessary to kind of understand when I say qi what I'm actually talking about. So, a central concept of traditional Chinese medicine is qi. Qi is the body's vital energy. It's what animates us. It keeps everything moving, nourished, and functioning the way that it should. I put up here the character for qi, which is made of two parts. The lower part down here is actually a symbol for rice or nourishment, kind of life's basic sustenance. And then the upper part up here, it's the steam. It represents the invisible, the force, the vital force that rises within us and nourishes us. With both of these parts, you can see how qi is both physical and energetic. The idea is that it's the food that fuels us and it's the invisible energy that animates us. It's both tangible and unseen. So here we get into the good stuff. All right. Um, so let's see here. The qi that I just talked about travels throughout specific pathways of the body called meridians. You can think of meridians as an energetic roadmap connecting our organs, muscles, and tissues. When qi flows smoothly, we feel healthy, strong, and balanced. When it gets blocked or stuck or depleted, that's when we start seeing health issues show up. So again, acupuncture works primarily as a preventative medicine versus kind of a reactionary or acute medicine, although it can do both. But it's really about trying to keep balance before things get stuck. In acupuncture, we directly work with these meridians to help restore the healthy movement of qi, whether that's boosting fertility, regulating hormones, improving digestion, or simply supporting the body's natural ability to heal and thrive. Although this medicine is rooted in ancient text, it fascinates me how modern science is just now catching up to some of these traditional ideas. The ancient teachings were, in their own way, describing neurophysiological effects of acupuncture. This is something that now Western medicine is starting to fully recognize and appreciate, which is incredibly exciting. So we're getting more and more studies. I apologize, I have to admit somebody, my apologies. So in modern terms, acupuncture points closely map onto the peripheral nervous system and the key neurovascular bundles. This is really an offering of a beautiful bridge between ancient wisdom and current science. So what is acupuncture? So how does acupuncture work, essentially? So before I start a treatment on somebody, I really like to sit and take time and kind of debunk a little bit of the mystery behind acupuncture, although it is an incredibly beautiful medicine. And there's lots of really, I don't want to say magical, but there's a lot of really neat things to experience within the medicine itself. I personally like to know how things work. That's how my brain works. And so that's what you guys are going to get today is just giving you a little bit of an overview of things that we do know that acupuncture can affect. So simply put, acupuncture works locally by putting needles below the umbilicus and above the pelvic line. The immune system is going to respond wherever I put the needles. the immune system is going to send oxygenated blood to that area, again, below the umbilicus, above the pelvic line, kind of in that little paunch area that we have. When I do that, that oxygenated blood, that nutrient-rich blood, is going to flood that area, helping with everything from endometrial lining, follicular development, even semen motility. The second thing that it does is it has an indirect hormone function. And that means that anything that kind of governs or follows a cycle, and that could be your sleep cycle, your digestion, your menses, acupuncture has an indirect hormone function or kind of a yin-yang balancing, kind of going back to the classics there. And the third thing, and the most important thing, is acupuncture is an amazing stress modulator. When we're in a state of stress, our body is doing an incredible job of keeping us safe. It is rerouting blood flow to our cardiovascular and our respiratory system so that we can stay at a heightened level of alertness, that we can respond to that text, we can get to that meeting, you name it. Unfortunately, it is stealing blood away from something called the parasympathetic system or parachute. And that's where all the magic happens. That's where sleep is fantastic. Your menses is on point or on time. Your poops look great and you're not feeling stressed the same way. So let's take a look a little bit about what I'm talking about here. So those two systems, the sympathetic and the parasympathetic, belong to something called the autonomic nervous system. I won't go too heady with the science, I promise, but it is good to just kind of see you're either in one or you're in the other. And so when we're in a state of stress, the body again is diverting blood flow to organs to do particular functions, to really be more reactionary. Again, this is called the fight or flight system. The idea with acupuncture is the 30-minute sessions that I have you with acupuncture's innate ability to kind of pop you back into that parasympathetic state or a rested, de-stressed state is I'm hijacking your nervous system, popping you in that parasympathetic state. And the more often your body makes that neurological connection between you and a rested state, the more often the body produces something called a beta endorphin or relax endorphin. Simply put, there's a great signal in the body that we have the resources to share with the parasympathetic system so that we have the resources to give into the to the uterine blood flow to kind of our nervous system to kind of relax. It basically signals that we are there's abundance essentially. A little just a reminder, because I don't know if you guys did in grade 9 science class, but the parasympathetic is like parachute, kind of think of slow and steady. That's the one that we're kind of aiming to be in, although we do need both. There's never just one benefit of being in one. So let's take a closer look at what I am actually saying here. So when we stimulate acupuncture points, again, three main things happen. So local, at the at the site of needle insertion, acupuncture triggers a local response. So it reduces inflammation and releases endorphins, so your natural body's kind of painkillers. It also increases blood flow through vasodilation. This helps relieve that perceived pain and also jumpstarts tissue repair. So again, local, this would be something like endometriosis or for menstrual cramps. If I put needles into the point that I am trying to, or the area that I'm trying to affect, there will be more blood flow and there's going to be some pain modulation at the site. The second thing that it does, it has a segmental effect on the nervous system. So this stimulation now signals up the spinal cord and affects a segmental response. This not only amplifies the pain relief, but also influences any kind of nearby organs or tissue that share that same neurological pathway, improving the actual function of the organ. So now we're going through the spinal cord and kind of back down again to the organ that I'm trying to affect. And for most infertility, it's either the pelvic cavity for gentlemen, well, it's both actually, pelvic cavity for both male and, people with ovaries and with semen. All right, and the third thing that it does, and most importantly, we kind of touched upon it in the earlier slide, it has a central regulatory effect. So this signal now is reaching the brain where it can help that autonomic nervous system. It's going to do a major shift from the dominant fight or flight or sympathetic towards that rest and digest phase. And that is essential because, again, you can be only in one system or the other. And we're trying to get you back into that rested state. So a little more science coming at you. Let's see here. So as I mentioned before, acupuncture has an indirect hormone function, so thereby helping the body's innate internal rhythms. by supporting systems like the HPO, or the hypothalamic pituitary ovarian axis, which is a key trigger for any kind of hormone communication or menstrual health. We can kind of get more of that cycle regulation, which is imperative for IVF, IUI, or just in general natural fertility. There was a study done in 2021 that investigated the effects of pregnancy outcomes with use of electrostimulation, or applying electrodes to the needles themselves, in rats that had thin endometrial lining. The thin lining basically is a condition that can impact fertility due to low endometrial receptivity, or just essentially just not enough tissue for implantation to happen. The electrostimulation treatment actually led to an increase in endometrial thickness, the number of blood vessels, and it indicated improvement in the actual structure of the endometrium, or pedipod formation, or lining, the way you look at it. Let's take a look at what kind of TCM sees in this kind of indirect hormone function. So in TCM, the menstrual cycle reflects that balance of yin and yang, similar to estrogen, yin, progesterone, yang. The reduction of stress hormones like cortisol can also help regulate things like FSH, or follicular stimulating hormone, and LH, luteinizing hormone, which happen to surge at certain times throughout the menses. And it can help it helps us with a clearer sign of ovulation. Let's talk a little bit about the yin phase, or kind of that follicular phase. In that phase, your acupuncturist is really working on building that uterine lining and nourishing the eggs that will be ovulated. In that yang, or luteinizing phase, we really want to support a strong ovulation, so making sure that we get a great fluctuation in that LH surge, something clear. And then ultimately we're helping with implantation. Yin is kind of building of kind of heavy materials like blood, where yang is kind of warmth. The idea here is I really want to make sure that the body has enough circulation and warmth to really nourish that possible embryo. Restoring that yin and yang balance improves cycle regularity, ovulation quality, and symptoms like PMS or PMDD symptoms, again, through the variety of its pain modulation quality. And then initially, when I was doing this presentation, I had all kinds of studies, and I kind of decided to slide a few of them to the side because they can get a little bit heady, but we can talk, of course, at the end about anything that you're curious about. But one study that I did want to share with you is in a large review. A study combined 7 studies that examined over 1,300 women doing IVF. Acupuncture was suggested around the time of embryo transfer, and it significantly boosts success rates. Again, this may be in part due to acupuncture's ability to reduce stress and then also increase circulation to the abdominal cavity. The study suggested that by adding acupuncture during an IVF cycle, it could significantly increase the positive outcome of just doing IVF alone. So usually at this point, no matter what science has been throwing around, the question is, yeah, but does it hurt? It's a great question. It's a really great question. So I have one colleague that likens the insertion of a needle to almost the feeling of someone kind of plucking an eyebrow. I have one gentleman who I see on the regular at the community acupuncture clinic who calls me the mighty mosquito. So yes, you do feel a slight kind of a pricking sensation upon the needle inserting to the skin, but once the needle is inserted, you shouldn't be feeling any kind of discomfort. In fact, there's other sensations that I am trying to cultivate that are anywhere between kind of heaviness, a pressure, kind of a weighted sensation, or like weighted blankets on you. You might also feel a little bit tingly, throbby, itchy right at the site of insertion. That's just blood flow going really quickly to the area. That is kind of a high five. Your immune system is responding well to the treatment, but the sensation itself does decrease. You won't be feeling that kind of throbby or itchy, tingly through the entire session. It's just the immune system kind of responding. Heaviness can be felt at certain neurovascular bundles or certain acupuncture points. And usually your acupuncturist will give you a bit of a warning that that's a sensation that they're going for. Keep your practitioner always kind of involved in the process of treatment itself. Nothing ever needs to be endured. I know that for the most part, as women, we can put up with a lot. This therapy shouldn't be one of them. So there are more than 365 points on the body. If ever in a treatment there feels like a point on the body that is a no-go zone or you don't want attention to it, there are definitely other access points. And just remember that through this entire process, you are boss. You get the final say as far as, what and how kind of you feel. In my session, I love to show a sample of an acupuncture needle because usually by the time I receive a patient that has gone through either IUI or IVF injections, they laugh at the size of my needle because, as you can see, as in comparison here, it's basically whisker thin. It's quite pliable, it's flexible, and it's covered with a silicone coating that actually makes the insertion of the needle a lot, well, you feel it quite a bit less. When you come in for your first session, it's going to be very different than maybe a Western session. We sit down for at least half an hour, possibly longer, and we go over something called the 10 questions. This is my rubric in TCM. I'm trying to find patterns, and patterns really are much like in regular science. They're everything, and so I'm going to ask you everything from your sleeping habits to your menses, even possibly an emotion that might be ruminating lately. Maybe you've been going through quite a bit of stress, or maybe you've just been feeling a little bit down and in grief. They all mean something in Chinese medicine. Um, there are different patterns that I am trying to detect to see, again, what makes you thrive, other points that I can add to your fertility protocol that'll really help you get the most bang for your buck, get the most out of your treatments. So let's talk about frequency. Now, this is important. So I recommend starting acupuncture 1 to 3 months before IVF or IUI, and that generally is about a 30-minute session once a week to prepare for treatment. That's a similar recommendation that you'll find for any kind of preconception care. That could be supplementation, even going through some of your baseline blood work. They tend to do it kind of 3 months out, and the reason for this is a variety of reasons, but it takes about 3 months really to kind of get that new rhythm to really help or have the supplements, the acupuncture to really make a significant change in the body. It also gives us a little bit of time to figure out whether or not you like it. There are different tools that I use depending on the person as well. And it gives us a little bit of time versus being under the gun on the day of transfer. It's your first ever acupuncture, which is fine, but it's a lot of pressure on the body to respond the way that we want. Secondly, to keep in mind, so again, in preconception, it's once a week. As soon as you start any kind of stim meds, either through IUI or IVF, twice a week is minimum. And the reason for that is we want to get, again, the most out of your stimulation medication. We want to keep triggering to the body through its local response that this is where I want blood flow to go. I want more nutrients to this area. I want to build those follicles. Or if you're looking more into an IVF cycle, I want to build that endometrial lining. Pretty standard. So if you're doing an egg retrieval, if you're doing an IUI or embryo transfer, it's a slightly longer session. It's about 45 minutes. And for the most part, we offer pre-sessions. The only one that has a post at the moment is embryo transfer. Everything else is kind of day of. We'll do a 45-minute session before you go into the OR. Implantation, take a bit of a break from us. So if you're going through IVF and we've done an embryo transfer, in that implantation window, we want to clear out. You don't want acupuncture about 5 days after your embryo transfer. A little bit different with an IUI. We want to see you about 2 days after your sample has been received. The difference here, of course, is, well, same and different, but what we're trying to do with these two protocols is increase circulation as much as possible to the uterine cavity, but then ultimately dropping cortisol and prolactin levels. Remember before I was saying that when we're in a state of relaxation, we produce something called a beta endorphin, or again, acupuncture helps produce that beta endorphin. We want to signal to the body that this is a great place to be, it's a great place to set up shop, and that the body can handle a little bit more workload. And then afterwards, you're looking at roughly about 1 time a week until we've locked down betas 1 and 2 in that first ultrasound, until basically we have a positive pregnancy. We tend to suggest that people who have received acupuncture through their preconception continue until their first trimester is over, just to kind of get over that first trimester hump. Acupuncture can help with anything from nausea, anxiety, insomnia, so anything that first trimester kind of brings with it. And then again, acupuncture is safe to do through your entire pregnancy. We do leave that kind of up to you as far as when you feel like you need a little bit of a boost. Once a month is generally the recommendation. If you need more, there's no harm in coming in for more. And then the really unique thing with TCM specifically is, let's go to breech support. If you have a rebel baby that wants to be, sideways or breech upside down or any which way, TCM has a way to actually flip the baby right side round. We do something called moxibustion therapy, and I can get a little bit into that later if you want, but it really is unique. The moxibustion itself is something that we give you as homework because we ask you to perform this kind of burning of this Chinese mugwort on yourself, on your pinky toe, to help with that stimulation of the uterus. Also involved is labor induction. I am a really big fan of the underdog, and some of my favorite patients are those that happen to be maybe over 40. And a lot of REIs and gynos will ask to induce women that are past a certain age. This is a tool to have in your toolbox. As you're leaning past week 35, come back in for acupuncture twice a week, and we can start getting things flowing again as far as circulation, and do some cervical ripening so that we're not dealing primarily on kind of a Western induction support. Let me just see if I covered all of that. I did indeed. Okay, let's talk a little bit about finding your people. So in an ideal world, you want to be looking out for anybody who is registered with the CTCMPAO or whatever provincial college is in your area or province. If that isn't obviously available, I also am a big fan of naturopathic doctors. They are one of the few that do practice acupuncture who have studied traditional Chinese medicine acupuncture. And I find that a lot of NDs might even specialize in fertility medicine in preconception. So those are my two go-tos. You again want to find somebody who specializes in fertility. Again, like with any school, with acupuncture or TCM, we go through school and we learn the whole enchilada. We learn everything, and then at the end, we can kind of decide where we want to shoot off from. I would personally choose somebody who does love working with fertility and reproductive health, and also somebody who has worked with fertility clinics so that they know what gonal-F is. They understand kind of what part of your cycle you're in. And then more importantly than that is finding someone that you click with. So pro tip, most practitioners will offer a complimentary introductory call. That has less to do with you giving them a laundry list of kind of what you've gone through. That's Reserve that more so for your first intake, because they're going to ask you those questions. This, honestly, I believe, treat it more like, see if you click with the person energetically, if you kind of align, because that's important. Again, you're working with your energy field, and you're working with somebody who's going to get you through a relatively stressful period. This is not a cakewalk. I won't sugarcoat it. Fertility treatments in general, they demand quite a bit of you, and so finding somebody who is on your side is super important. I happen to be blessed with, I work with a group called Conceive Health. Pardon me, they are naturopathic, they're naturopathic doctors. I'm one of the only just straight up TCM or Chinese medicine practitioners. So Conceive is one of the only naturopathic clinics in Canada situated within a full service fertility center, so Trio Fertility. It has a unique and integrated clinical model where transparency and effective communication is shared within your endocrinology team. Um, as preconception doctors, they focus on the building blocks to improve your fertility, everything from your egg quality or sperm quality all the way up to your transfers, your IVFs or IUIs. One other thing about this location, specifically talking about their flagship at down at Bay, we have a bunch of fertility clinics around us that we do service. So we're right across the street from or around Create. Let's see here. Hannam is pretty close by, as well as Innova, as well as Mount Sinai Fertility. And so sometimes people choose to come across the street and get their pre-post acupuncture sessions with us and then go back to their clinic. Again, it's all about kind of finding a team that'll help you kind of achieve your fertility kind of goals. And then lastly, if you are interested in any more information, you can always reach out to me or to Conceive. I do suggest doing that little 15-minute consult to see whether or not preconception care is something that you're wanting to look into. But more importantly, again, going back to acupuncture, starting off acupuncture with a little bit more leg room will make a difference in kind of outcome. So starting early. And that is my presentation. I'm going to stop sharing and head it back to you. Let's see here. There. Okay.
Yes, so I'd like to give a massive thank you to Lisa for this great presentation full of wonderful insights on, the marriage between acupuncture and fertility. Thank you to all who have joined us, and to all watching. We continue to wish you the best on your journey and support on your path. And until the next time.